The total number of deaths related to alcohol north of the border were almost equivalent to deaths related to all the other drugs combined. Well, why is no one talking about this? Let's first speak to Alison Douglas, Chief Executive of Alcohol Focus Scotland. Alison, why do you think people aren't making a big noise when it comes to the number of deaths from alcohol happening at present?
Well, hi, Alex. I think, you kind of put your finger on it that we are very accepting of alcohol's role in our society. And unfortunately, that means that we are almost accepting of the harm that it causes. I suppose there was a difference between the alcohol deaths and the drug deaths in that we had been seeing a downward trajectory in alcohol deaths in Scotland for a number of years. And suddenly we've seen this increase of 17% in 2020, which we think is probably a lot to do with the impact of the pandemic on people's drinking habits. There's a lot of evidence that people, particularly heavier drinkers, were drinking more during the pandemic because of the social isolation and the stress and pressures, many people's livelihoods being at risk, that kind of thing. So it was truly shocking. And I think you're right to compare the attitudes, beliefs and response to the level of problems that we have between alcohol and drugs, because alcohol is killing very many more people, but it's also having a huge effect on people beyond the drinker. And I think this is something a lot of our narrative is really about, well, this is my choice about whether I drink and how much I drink, and I'm not affecting anybody but myself. The reality is somewhat different, that friends and family are being affected. During the COVID crisis, again, people were hothoused with their families. Many people were contacting services saying they hadn't really realised just what an alcohol problem their partner or another member of their household had, and that they were really concerned now that they were seeing it up close. There were a lot of reports to the NSPCC about worrying about children being in households where parents were drinking. So yes, it is something that we have a kind of collective amnesia about, or unwillingness to recognise the full extent of the impact of alcohol on us and on those around us.
So what can be done? Because, I mean, if we're going to be realistic and pragmatic about this, we're never going to ban alcohol, are we? I mean, the nighttime economy is too vast. In fact, the amount that the food and drinks industry give to this country's GDP is enormous, and it would seem extremely heavy-handed to go down that route. But we've tried everything. We've got sin taxes, we've got public health campaigns. Where are we going wrong? Why haven't we managed to get this problem and start to sort it out?
Well, you say we've done everything that we can, but actually at UK level, we're really not implementing any of the 3 best buys that the World Health Organization recommends. So those are controlling the price, restricting the availability and regulating alcohol marketing. We're not really doing any of those things at UK level. We've got a taxation system that is completely unrelated to the amount of alcohol in products. So that the government has committed to reviewing the alcohol duty system, and we hope that they will link it to how much alcohol is in the products, because the more alcohol, the more harm is caused. As I said, availability, we now see alcohol sold in hairdressers and cinemas, virtually every corner shop. In England, you've got more permissive licensing hours than we have here in Scotland, but the more readily available it is, the easier it is to purchase and consume alcohol, and more normalised it becomes because it's part of the wallpaper. And then on alcohol marketing, we have a global alcohol industry which spends millions and millions of pounds telling us why alcohol is essential to having a good time and to being popular and having a great social life. And that affects us. It affects our perceptions of alcohol. And, if you think back, say 40 years ago, people socialise. If you dropped round to somebody's house, they offered you a cup of tea. Nowadays, it's much more likely to be that glass of Chardonnay you were talking about earlier, Alex.
Oh, do you know what? I do advocate a good glass of Chardonnay from time to time. But why is it in particular that the UK and especially Scotland seems to have an issue with this?
Well, Scotland does have more of an issue than a lot, than England as a whole. So we definitely drink more, and more of us die as a consequence of that. But parts of England have similar problems to Scotland. The northeast of England have similar scales of problems to those in Scotland. But I think, throughout the Western world, alcohol consumption has increased and has become normalised, and a lot of that's linked to us having disposable income. Nowadays, we see global alcohol corporations targeting emerging economies like India and Africa with particular products in those areas. So this is a global industry, and we cannot expect industry to regulate itself. Industry exists in order to make a profit for shareholders. So if we're going to try and combat the way in which alcohol is so heavily promoted and so readily available, then that has to be through government action. And as I said, the World Health Organization has a blueprint there which the UK government could follow in order to have an effective alcohol strategy. There basically is no UK alcohol strategy at the moment.
Alison, thank you for coming on and explaining that to us. That's Alison Douglas, CEO of Alcohol Focus